Hey there, good afternoon, and welcome to Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. I'm Tre Tailor, and do you have a loved one in a nursing home, or are you concerned about your elderly family member because of COVID? Well, this beautiful lady right here to my right and your left, Dr. Macie Smith, is going to join us in just a short to give us all the information. But first, here's some COVID community updates. Poll workers are needed for the upcoming June 9th election. It pays about $165 a day, and they need you to work. Call Mrs. McClary. The number is 803-576-1519 to be a poll worker. Speaking of the polls, election time is upon us, and the polls are actually open right now. That's right. Early voting, absentee voting is available in pretty much all 50 states. Now, depending on where you live will depend on where you go. If you live here where we are in Columbia, South Carolina, you can go over to 2020 Hampton Street for the voter registration building. They're open from 8:30 a.m. until 5 p.m. You can go there and cast your vote. If you do want to mail in your vote, you can email scvotes.org, and they'll send you an application. You'll fill it out, and then you can mail it off. However you do it, please don't forget to vote. And like I said, right now, you can vote early and often. Also, testing is going on throughout the state for COVID. Now, DHEC has several testing sites. Go to their website, dhec.com for more information. Prisma Health also has a very comprehensive website about their testing locations. They not only have some community locations, which a couple of those are this week throughout the state, so check that out. They also have drive-through. Drive-through testing is available in the upstate, Sumter, Lawrence, Oconee counties, and also in Columbia, South Carolina. Those sites are typically open Monday through Friday from 9 a.m. until 6 p.m. Go to prismahealth.org to see the full schedule of their testing sites. All right, that's it for our COVID community updates. Dr. Macie Smith is a gerontologist, and she's an author, and she is an expert on all things elderly. Aren't you?
The elderly whisperer.
And you are, and you are, you really are. I mean, Macie did some work for my family a couple of years ago. We have an elderly family member in another part of South Carolina. And Macie was just so great at being able to, one, communicate with my aunt what her needs were and come back and communicate to the family when my aunt had to be hospitalized. Macie was an excellent liaison between her, the family, and the hospital, because she knew all the ins and outs of the hospital. She knew the medical terms, what my aunt needed and what she needed to have, and was able to really advocate for her. So outside of COVID, if you need someone to help you with your elderly family member, I'm doing a Dr. Macie Smith commercial right now. She does. Look, Nicolette Robinson said, Dr. Macie rocks. Nicolette, we were just talking about you. We were just talking about you, Nicolette.
Good vibes. Yeah, Nicolette.
So yeah, definitely check out Dr. Macie Smith. So Macie, the pandemic is hitting nursing homes hard.
Yeah.
Why is it that it's running rampant in our nursing homes within our elderly population?
Well, first, I just want to thank you, Tre. I've been watching you I didn't realize you were doing this for 6 weeks until we talked offline, but I know for the past 3 weeks consistently, you have been bringing very, very vital COVID-19 related information, so much so until it's like, oh, I didn't even think about that. Oh, that is a great point. And so you're providing well-needed information to our communities and also to the community of people, like you stated earlier offline, who only get their information from social media, from Facebook. Right. And I think about my mom. She still watches the news and she reads the newspaper, but honey, she'll call me in a minute and say, well, on the Facebook, they say, first of all, who is they? Spell the person's name, but they're getting their information. So I appreciate you providing credible information and valid information. So thank you for that. And
thank you. Thank you.
Just highlighting the senior population as it relates to this pandemic and this public health crisis. From my understanding, and I'll always like to say, from my understanding from credible news outlets, when this thing first started here in the U.S., the nursing home out in Washington State around the Seattle area is where we saw the bulk of the cases. And what we know now that we did not know then is that close proximity to other people, droplets, tears, saliva, sneezing, and coughing, if it enters the person's mucous membranes, they have an extremely higher risk of developing the virus or contracting the virus. And when we think about our senior population, a large number of our older adult population are living in congregate settings, in the nursing homes, in the assisted livings. We have a large group of people, of our seniors, living in the community too, but moreover, they're in congregate settings, so they're in close proximity to one another. Mm-hmm. Also, our seniors have a propensity to have comorbid conditions, other chronic illnesses. Let me keep it 100%.
Oh, did we lose Macie? Oh, there you go. Oh, now we don't have your order. Okay, you're back. You're back.
You got me? Yeah, I got you. I have Do Not Disturb. I don't know what's happening. Okay. They more than likely have sugar, high blood pressure. Right,
they've got pre-existing conditions. Yeah.
Pre-existing conditions. And as you stated, breaking down that terminology and what that actually means, right? Because they have these other conditions, cardiovascular conditions, respiratory issues, asthma. Right. They're more susceptible to the virus, and they're more they're highly likely not to do well recovering from the virus. And so, because when we get older, our bodies change. Doesn't necessarily mean we're all going to have these pre-existing conditions or these comorbid conditions. However, our bodies are changing and our brains are changing. Our muscle mass is a lot less than what it used to be. Our sleep patterns may not be what they used to be. We may be dealing with depression as we get older because we've lost family members and loved ones or lost abilities. And so all of these things combined, the congregate setting and the health conditions, really puts the senior population at higher, if not highest, risk.
Yeah. Like Jeffrey Johnson said, their immunity system is weak. So, and you know what, Dr. Nicole mentioned this last week on last Friday's or Saturday's show. Someone asked, well, why is it that people with diabetes are at greater risk? And just like you said, and just like Jeffrey said, because your body is already fighting something else that's going on in your body. So now it's not 100% so that it can fight whatever else you've got.
Right. So, and we got to think about the strength too. Their strength and their might to fight it. Do they have the ability physically, mentally, emotionally? All that plays a part in overcoming or, ridding yourself or your body of various viruses and diseases.
Mm-hmm. So Macie, all right. So we know that, as you said, their immunity system, they're already ill. So are they getting it from, I guess, people coming from the outside, like people coming in and visiting, or some of the workers that have been on the outside coming in working? How are they being transmitted? How is it being transmitted?
So from what we know, because when we think about assisted livings and nursing homes, that's their and independent living, that's their private home. That's their personal space. So they come and go just like anybody else does, with transportation. So they're going outside of the facility to the doctor's office, to restaurants, to go shopping. And so they can contract it from anywhere, just like we can. Right. Also, too, the staff working in those facilities usually have more than one job. When we think about our direct care staff and those providing the bedside care and the hands-on care, they typically have other hands-on and in-home care or healthcare positions too. So they're engaging with people outside of that facility as well, other individuals who are at higher risk for developing the virus. And so it can come into that facility just like it can come into your home, just by engaging throughout the day.
Right.
And so that's why it was so vitally important for eventually for South Carolina and other states to do 100% testing in the nursing home. Because we got congregate settings, we have the senior population, and then we have multiple outside influences that could increase the risk.
Right. And then when they come on in there and they're all together, they're eating together, they're playing cards, whatever together. So they're all
engaging together,
engaging together. Yeah.
and close within 6 feet. Now,
Yes.
a lot of our individuals, they can't hear that well. Not all of them,
Right,
but
right,
a lot
right,
of them can't
right.
hear that well.
Oh, you making
So
a
you
great
got to
point.
get
You got to
close
come up
up.
close.
You got to come closer to speak in their ear, speak
Yeah.
louder. And with the more vulnerable populations, think about our seniors who have cognitive impairment or dementia, you got to be in their face so that way they can see your facial expression, the movement of your lips. And so the nature of our work is close proximity, which is why I have no idea why it took us so long to do 100% testing outside of symptomatic testing for that particular population. Now, I am thankful that this population will be the last to be quote unquote opened up. Because of the vulnerabilities and the
Right,
higher risk,
right,
there's still a
right.
mandate in South Carolina and across the country to eliminate or limit as much as possible
Outside business.
outside visitors unless it's an end of life situation.
Wow, wow. Yeah, yeah. I agree with the Jeffrey saying, wow, yeah. But you're right. If that just makes sense because this is our most vulnerable population, like people in the hospital. You're in the
Right.
hospital because you're sick. So you just can't, people just can't come all in and out all willy-nilly, you know.
Right. And it makes sense because it does reduce the risk. The challenge is, and my heart goes out to anyone whose loved one, who's an older adult who has complications when they go into the hospital and they have to be admitted. That family member or that loved one is now having to depend on medical practitioners to take care of their loved one. Yeah. And in a regular situation, I often, and Trey, you know this, I tell family members, if you got to leave, have somebody else relieve you, because in a hospital setting, that's an emergency type setting. I wholeheartedly feel that they do the best that they can do on a regular basis, but communication is missed a lot of times. Things aren't followed through a lot of times due to the lack of communication. So you add the layer of this pandemic on top of that.
Yeah.
That's challenging for the family members. It's challenging for the senior who is scared and fearful. And so that just adds another layer of anxiety. But that's why we have to turn to, like you're doing, technology. Send them in there with an iPhone. Send them in there with a smartphone that you can get on Facebook. I'm totally serious about that. If it's an emergency and they're going into the hospital, get somebody's name who's on that floor, so that way you can call them directly and tell them what you need. So that way, if you need to bring any type of technological devices, you can get it to that worker that's there to get it to your family member. And from what I've been hearing, because I haven't been in the hospital or the nursing homes at all, but I've been training administrators out of the hospital and nursing homes, and they are very, very much on board with engaging with family members as much as possible. They are not averse to that at all.
Dr. Macie Smith joins us. She's a gerontologist, a senior citizen expert. She joins us today on Coping with COVID. I'm Tre Tailor. Jeffrey Johnson says his ex-wife contracted the coronavirus in the nursing home that she works in. And yeah. Wow. And he also wants to know if this is a virus or a bacteria. It's a virus, right, Macie?
From my understanding, it is a virus. But, and the more I'm learning about the research that's continually being done, it's almost akin to when we started learning more about HIV.
HIV, yeah.
That virus that turns into or evolves into AIDS. That's just like the coronavirus evolves into COVID-19. And so, before, when we started learning about the HIV virus, we didn't know where we would get it from. We thought we got it from talking to people, kissing and touching.
Right. And we thought it was just a gay disease too.
Right. We thought it was just a gay disease. I remember even before then, I had no business knowing nothing about it, but monkeys, it was a monkey issue. You know what I mean? And you're right. And so when we learn more about it, it's almost like that, because your highest risk of contracting it is through bodily fluids, from mucous membrane to mucous membrane.
We lost Macie again. Hopefully we're going to bring her back. We're talking to Dr. Macie Smith.
I'm sorry.
That's fine. Are you there? I can hear you, but I can't see your beautiful face.
Oh, okay. It's gonna come in a minute. I have it on Do Not Disturb, but it's coming through.
It's anyway. Disturbing you.
I'm so sorry.
It's okay.
Yeah, it's not listening.
Well, you know what, Macie, while you're coming back on, I do want to mention you're right. You made the comparison to HIV AIDS with this COVID-19 coronavirus. And if you guys remembered that, as Macie said, because of the HIV AIDS, it took, we're probably at least 20 years, 20 plus years into HIV AIDS, and there's still not a cure. There's still not a vaccine. There's medication. There have been great advances to medication to where people can live good lives. But compare 20 plus years of fighting HIV AIDS and still no vaccine, and where we are less than 6 months in, just less than 6 months in dealing with the coronavirus. And, people are saying or thinking, why haven't there been more advancements? Well, if you compare this to any other disease, it takes a while to figure it out.
Does.
We're still learning every day new things about it.
Right. And two, it takes money. You know, it takes awareness, and it takes a ton of money to do trials and research. We're to the point now with HIV where people can be undetectable. I think that's the term. They can take medication and be undetectable. But, I do feel like, just like with the flu and the Spanish flu, and what was the other thing? Smallpox, but I had one of my seniors, he was telling me about, oh my gosh, something he went through.
SARS,
polio, back in the day, polio. And so, a vaccination is very realistic. And because there's a lot of money involved with the research and developing treatment and developing vaccinations, and it's not really a stigma associated with a negative stigma associated with it, we may see definitely more advancement to a treatment or a vaccination. But again, from what we're hearing, it's still going to take almost a year, if not a year,
exactly,
to get to that point. And so what I'm thankful about, and this is what I tell my families and just colleagues, that there are ways to prevent it. And there are reasonable ways to prevent it.
To prevent exposure to your
to prevent exposure, right? To your elderly family member, to yourself. Just better understanding the facts of how to reduce the risk. And these are things that we do every day. We just need to do it a lot better now. Washing our hands for 20 seconds, not putting our hands in our face or in our mouth. I wear glasses a lot. I wear my contacts very rarely now. I wear my glasses more so because, it's a barrier, and it prevents me from putting my hands in my face. So anything that you can do tangible, realistically, within the normalcy of your day-to-day is what you want to implement. And that's something that we can do for our senior population. Stop scaring the bejesus out of them, right? Cut the news off, the news station that talks only about the negative and showing seniors being rolled out in body bags out of the nursing homes.
Right.
We have more people who recover from the disease than who don't recover from the disease. So let's definitely keep it into perspective, the risk, but really talk about things that makes people hopeful about the situation. Yeah.
Dr. Macie Smith joins us on Coping with COVID. I'm Tre Tailor. Hey, Jeffrey, I see you've got 2 questions, but I'm going to just ask Macie to kind of go into a little bit more about the elderly population, but we'll get to your question in just a minute. Raina Perry is also watching. Thank you, beautiful. We appreciate it. So, Macie, you said basically to help our seniors, one, don't expose them to so much information. Just say, and really that's for everybody, like you said, definitely. People are definitely, constantly hearing the numbers. There's been this many deaths, this many cases. And as you say, don't let them see them rolling body bags out of nursing homes. That's going to scare your elderly person. It's scary.
Not only for the senior, the staff who work with our seniors in long-term care community, the family members of those individuals in the communities and at home in their personal home. And so we want people to care for them. We don't want to scare the mess out of them. It was a facility out in the Seattle area where they had to evacuate all the residents who were there because the staff were afraid to come to work. And so they basically boycotted and didn't come in. But that goes to the PPE as well. Hospital has, all the hospitals didn't even have all the proper PPE to provide care. And so, the nursing home is going to be even less than.
That's right. Raina Perry says her 90-year-old dad gets overwhelmed by it all. So yeah, Raina, you've just got to, like Dr. Macie said, say, Daddy, let's watch the Flintstones or something.
Right.
Let's watch All in the Family, whatever his favorite show was back in the
Walk the
day.
Texas Ranger,
Yeah.
Columbo, I don't know.
Yeah,
Andy
whatever he
Griffith.
liked. Yeah, whatever he enjoyed watching back in the day, that's what he needs to be watching now, not constantly, because it can be overwhelming. Regina Henderson Moore, thank you for joining us. She says she asks her mother every day to share 5 things for which she is grateful for.
I love that.
Yeah, it really takes away her worries. I love that too. That's good. Yeah.
That is
Again, that's something we should all be doing. Just focusing on the positive and not the negative. I was talking to my grandson's teacher today, and when she was saying that she was, a little nervous, and her mom is nervous too. And I said, well, sweetheart, you have to stay calm. It's so funny because she said her mother raised them to believe, to keep your faith, but both of them are freaking out. I said, well, you have to remind her, keep the faith. You taught us, Mommy, to keep the faith. So we're going to keep the faith and just trust God that this is going to be okay. And focus on what you do have. That's the other thing I told her. You have life, you have health, you have strength, you have a home to live in, you have food to eat, you have family who care. You got to focus on what you do have and not what you don't have.
Absolutely. And 2, just think about what's available to us, right? Think about what we have control over. Think about things we were looking forward to that seemed like it would never come, such as not having to go into the office every day.
Yeah.
You know what I mean? Such as having more time with your family members.
Yeah.
Such as having more time to clean your closet and do yard work. Now you can do that. Right? Just like you said, focus on what you do have and also what you have control over.
Right.
When we start focusing on things that we have no control over, that's when we lose control. We lose hope. We begin to frantic and panic. And then that's when other diseases and other chronic illnesses could surface as well, which puts you at higher risk of developing coronavirus.
Exactly.
Contracting it. I'm sorry, not developing it.
Jeffrey says, do the work needed to take care of yourself. That is so important, Jeffrey, because that's different from everyone. Like Nicolette says, she plays Andy Griffith all day at the house.
All day.
And you know what? What does that look like? Does that look like, again, reading your word? Some people just have to read the word, listening to spiritual music. I'll tell you, even if I'm not in a room, there's some gospel music going on in that room. I've got so that the spirit is there when I get there.
That's right.
That's just for me, so it may be whatever your drink of choice is. I mean, whatever you've got to do, exercise, because you can walk outside, and it's different for everyone. We've got to take care of ourselves. And I love, Macie, that you say, take control what you can control. We can't control all of this other stuff.
No, we can't control other people either. That's why we put on our own mask and we ensure our own distance. If you don't have on a mask, if you coughing and all of that, I know how to go the other way and go in another store or do something else. Take control over things that you can. It's all going to work out. It has to.
Yeah. So let me ask you this. So if we have elderly family members in the nursing home, Macie, how do we deal with the nursing home? How do we deal with our family members, knowing that this has been a petri dish of the coronavirus?
Well, I would say, number 1, keep them calm and let them know, depending on their level of functioning and level of understanding, certain things you don't want to share with them at all. If they have a progressive cognitive impairment or dementia or Alzheimer's, the last thing you want to say is negative stuff like, I cannot come and see you because I might bring that virus in there to you and it's killing everybody. That don't do nothing for nobody. With that person, you may want to say, well, Mom, I'm out doing work from my house, or I have some additional work to do. I won't be able to make it there today. And you consistently say that, but I love you. And I'm, just good things. And you're talking to them on the phone. For someone who does understand, just let them know, well, right now is best that you're where you are, I'm where I am, and that reduces the risk. And once we reduce the risk, then the sooner we'll be able to start seeing each other again. Make sure that the staff, definitely the administrator, the director of nursing, the director of residential, they have means to communicate with the family. Visual means, digital means. If they don't, offer suggestions. A lot of the nursing homes and assisted livings, they're using Google Duo, they're using FaceTime, they're using Facebook Messenger. And so more than likely they have a means of engagement. This is physical distancing. It's not social distancing.
Right.
And so you still want to keep engaged as much as possible.
Yeah, I love that. Just you continue to keep the lines of communication open with your elderly family members. Don't freak them out. I can't come, just like you said, I can't come right now because you might catch the virus.
Yeah. But it's killing up everybody,
right. Right. Keep your stress to you. Don't put that on your elderly family member, because that's going to make it worse for them. So I love that you do that. And then maybe call more often. Again, do FaceTime and things of that sort. Those are all great suggestions, Macie. Jeffrey does want to know, how do seniors build their immune system up? Is that a possibility that they can do that?
Well, and that's a good question, because not all seniors have compromised immune system. Simply because you're over the age of 65 or 85 does not mean you have a compromised immune system. There are some seniors that are way healthier than any of us. They take no medication. They have good brain health, but biologically, time takes a toll on their bodies physically. Right. Yeah. And also cognitively with brain deterioration. That's natural. And so they build up their immunity just like anybody else does, in terms of drinking vitamin C or eating vitamin C, ensuring that all of their iron levels are where they need to be. They're getting their antioxidants every day. They're drinking their water. So anything that anybody else does to improve their immunity. So I'm not a nutritionist, so I can't tell you what the sea moss and the sea grass. I can tell you what all that is, but however you improve your immunity, that's the same way seniors increase their immunity, as long as there are no contraindications. And what that means is that there's not an issue with them drinking cranberry. There's not an issue with them eating blueberries based on what other conditions they might have, or what other medications they may be taking, or just any type of allergies.
Macie, also going back to the family member that's at home, how should we deal with them as far as coming to see them? We're out and about. The kids, are still out and about, going to the grocery store. How do we go in? Do you think we should be coming to visit our elderly family members, not that are in the nursing home, but at the home?
At home. So your senior loved ones who are living at home, should you go visit them? I think you should ask them. They'll tell you if they want you to visit or not. So I'll give you an example. My daddy, he is so funny. I came to his house and he met me at the door. So I knew you ain't coming in here, Right. And he said, I would hug you, but not do that. So they will tell you how they feel. If they're missing you and they say, I want to see you, but I don't want to risk you coming into the house because you go to the grocery store all the time, you work in the hospital, or you work with someone who has to go to dialysis. So if they want to see you, but they don't want you to come in the house, then visit them in the yard. Right. I can have a yard conversation. My daddy has a garden, so we walk through the garden because we have space, and take any opportunity to dispel any myths that may be going on, any misinformation, and just ask them how they feel and how they want you to connect with them. You don't tell them, Mom, I'm coming to see you. You don't tell them, Mom, I'm not coming to see you. You ask them how they're doing and how do they feel about, in an engagement. How do you feel about us getting together sometime? My aunt says, no, we're not getting together until the middle of July. You can come pick up your food and keep it moving. Okay. And I respect that.
Yes. Yeah. Well, Nicolette says her mother said their home is off limits. But Macie, what about if they do say, yes, I want you to come? Is it safe? Is it safe for us to come while we're out and about now that the state is open? Folks may be out and about going to Target and all these different places other than the essentials like the grocery store. Is it safe?
Well, and that's really hard to say black and white, Trey. But of course, if you have symptoms, absolutely not. If you can't determine, even if you think it's sinus issues or allergies, like I think, I still wouldn't go. So any symptoms that remotely relate to coronavirus, you don't want to go see them. But if you're healthy and they want you to come and see them, practice the guidelines that are identified on the CDC website or SCDHEC website, and that I would wear shoe coverings, or I would take my shoes off. I would wear a
Okay.
mask, and I would wear my glasses or some type of face shield
Great.
or face covering, and still be 6 feet apart. When
Okay.
you're in the house, you're reducing the risk of spreading germs that you may have because you may be asymptomatic. And so that's just what I would recommend. Either take your shoes off before you even get in the house, or use shoe
Okay.
covering. Still wash your hands as soon as you get there. Wash your hands throughout your visit. Don't put your hands in your face. Don't hug them. I mean, because even with a face mask, that's just me. Even with a face mask, I don't want to hug. You might have a tear in your eye. I might have a tear in my eye because I hadn't seen you in so long. I do virtual hugs. And I mean, I do a tight virtual hug because I'm a hugger, Trey. You know that.
Yeah.
You feel funny by not showing affection to people, but you want to give a good hug. You share emotions through your nonverbal communication, your
Right.
body language, your eyes, your facial
Yes.
expressions.
Yes.
So continue to do that even more so.
Yeah, Kimberly Mosley Gather says we sit on opposite ends of a long porch and visit.
Oh,
That's
I
beautiful.
love that. I
Yeah, I
like
love
that too.
that, Kimberly.
Open the windows, make sure the fan is on to have circulation. So it's physically distancing, it's not socially distancing. You still can engage with individuals.
Yeah. Now, what about going to the grocery store and stuff? Do you suggest that we go to the grocery store for our elderly family members, or do you think it's okay for them to go out? Even though I know a lot of stores have that a couple of hours in the morning for them to go. What do you think?
Well, the couple of hours in the morning for our seniors, that's fading out. I know
Mm,
Publix is not doing it anymore. I would recommend, if you can go to the grocery store for your senior loved one, I would continue to do that. Now, some of our individuals, they don't have family members, or if they do have family members, they're far away, or they're not willing to do that, or not able to do it because they have to work or what have you.
hmm
So if seniors need to go to the grocery store, mask up. Now, I got a little issue with the glove situation, and my seniors, honey, they love to put them gloves on. I don't like gloves because you can cross contaminate so easily with the
Yes,
gloves. If
yes.
I do wear a glove, it's going to be one, and I'm going to open all the door handles with that one glove, but I typically have a wipe in my hand. And I'm
hmm
constantly wiping my hands. And so they just need to mask up, make sure, again, don't put their hands in their face, make sure they have a wiping their hands throughout the whole visit. Stop talking to people in close proximity because they'll still, come here, baby. Let me talk
Yeah.
to you for a minute. No, ma'am, I'm gonna stand right here, 6 feet. So you can still talk, but make sure they across the room and follow the guidelines and the precautionary measures in the store. If you go to a store and you do not see any precautionary measures in that store, if I don't see that shield up, if I don't see feet telling you to stay 6 feet
hmm
apart, I don't go in that store. So
Okay.
I would recommend going to the store that has safety protocol. And I'm not, doing any type of commercial for anybody, Trey. I'm just saying what my experience has been.
Yes.
I've been in Publix. They have the arrows going up,
Yeah, they
and then
do.
the arrows and don't let somebody come up the opposite way. Excuse me, ma'am. You got to go that way, right? I'm that one, and then the next aisle I'm going the wrong way. I know Target has the shield up, but I stopped going in Target at one point because they didn't have those shields
Right.
up.
Well, I
And the
had been in
cashiers,
Target. Yeah.
yeah, they kept talking to me, and I was like, I
And
don't
didn't
want.
have a mask on.
No, yeah, I do not want. I don't want any insurance on this. Stop talking. Stop talking. And so
Right.
again, those safety protocols need to be in place.
Yeah, yeah, yeah. And so that's
Sorry.
good. No, that's good stuff. Jeffrey had a couple of questions. And then, Jeffrey, I really think your questions are more medical related. Why is a vaccination so important? Does wearing a mask and social distancing break down our immune system? I don't know if Macie can answer those questions.
Mm-mm.
And the $100,000 questions. So, why are we opening up the state if it's still so vulnerable? Look.
So that's that balance between economics and health.
Yes, that's exactly.
That's a
just like
political. Yeah, that's a political divide right there. Again, manage what you can control. Make sure you're taking in credible, reliable information, and use that information, use that science along with your faith.
Mm-hmm.
You're gonna make it.
And here's the other thing I say, Macie, and you're right to Jeffrey. The country is being opened up because of the economics of it all.
Impact, yeah.
Unfortunately, that seems to be more important than our health. But here's what I say to you, and Macie said this, and I may not say it as eloquently as she. Just because something's open, that don't mean you have to go. That's what I
had to walk through those doors.
Right. I have only been to, like I said, to the grocery store and to the drugstore. That's it.
Yeah. And see that, and that makes you feel that makes you feel secure.
Well, I just don't look. Yeah, I mean, those are essentials. I don't have to go on Target. Right. I don't have to go on. I try not to go on Walmart. I don't have to go there. You know, I try to avoid places where there are a lot of people. And I'm not going to the beach. As much as I love the beach this weekend, the beach was bananas. It was no social distancing at the beach. I didn't go. I wanted to take the kids to the zoo, but it was the first weekend. It was 1 million people and the animals in there.
Memorial weekend. So yeah, absolutely. You really have to take care of you and yours and make the decision for you and yours. So, you know, it just depends on the person. It's not about why they do it. It's about whether you're going to do it.
Right. To thine own self be true. Macie, I know you got to go, but can you give us any other tips, suggestions concerning our elderly family members in the nursing home and at home?
Yeah, the biggest thing I would say, Trey, is to continue to engage with them as family members. Don't focus on the barriers. Don't focus on the hindrances. Oh, I can't actually go to the facility, but I can still call her. Right. I can still send her a letter. I love opening letters, like the letters that people write, and my name is like handwritten. I was like, oh my God. Now I don't do it because I can't write that well. Send them a letter, send them a bouquet of roses. You can still engage with them.
Right.
You know, and as the viewer stated, you sitting on, each end of the long porch on the bench. And so they may not know other options. All they know is you can't come. But with us being more engaged than they are engaged, we can make recommendations. Well, Mom, I can come, but I'll just sit 6 feet apart. So that way, none of our bodily fluids will get on each other. Oh, well, that sounds good. You can do that. Yes, ma'am, I can. Oh, wait, come on. It makes them feel good that there is a way. So always focus on the way, the safest way to continue to engage. That's so vitally important. Just imagine being in a situation where there's a pandemic hitting your community the hardest, communities of color and the senior community, and you got, a little diabetes, a little sugar, and a little heart disease, that's going to affect that person's ability to be strong mentally, bringing about other conditions, depression that makes them more susceptible to contracting it. And so we got to keep them healthy, wholeheartedly, mind, body, spirit, and emotion, and spiritually.
Yeah.
So shout out to all the churches that are like hooking us up on Sunday morning. We can go to about 5 services.
I know you can, and I do. So Dr. Macie Smith, thank you so much for joining us on Coping with COVID. Please tell the viewership about your business and how people can contact you, because as I said at the beginning, Macie is amazing with helping to navigate your seniors through whether they're in the nursing home, in the hospital, or at your home. She is amazing with that. Before you do that, I want to mention that Ronna Perry said that they set up Zoom with her family to include their 80-year-old mother and 91-year-old father, and it's been a blessing.
I love that. I know they're excited too, because they're like, oh, we can do Zoom. We do the technology. Right. It gives them value. Perfect. Thank you for sharing that.
He said, thank you. Very useful and useful information. So Macie, tell us how we can get in touch with you and the services you provide, please.
Perfect. So I'm the owner of Diversified Training Consultants Group, and that is a geriatric care management group where as Trey stated, I help families navigate the long-term care system and help them reach the next level of care, whatever that looks like. I provide caregiver coaching and one-on-one counseling as it relates to caring for someone who has Alzheimer's disease and dementia or cognitive impairment. I'm reachable on all social media sites, and it's at Dr. Macie P. And my email address is info@dtconsultant.org. Contact number is 803-814-6721. Thank you so much, Trey.
Absolutely. Yeah. Did you get that contact information, Raina? Listen, I said this before and I'll say it again. She is so incredible with not only the elderly family members, but in helping to navigate the relationship between the family member, you, and whether it be the nursing home or the hospital. She is amazing in that space. She is definitely, you're definitely walking in your calling, and that she is so good. And I know, for those of us who have elderly family members, it gets stressful. It gets stressful, and you don't know what to do. And we're coming from a place of emotion. So to have Macie in the mix, she's coming from a place of calm and concern, and she has the expertise. Raina said, can you please give the information again? She didn't catch it.
Yeah, and I'm actually going to put it in the comment section too, Trey.
Yeah.
But it's my email address is info@dtconsultant.org. Contact number is 803-814-6721.
All right, you got it, Raina. We're going to put it in the comment section also. Please contact Macie Smith if you need more information. As always, we leave the broadcast by reading Jesus Calling. Macie, you are more than welcome today. I would love for you to.
Look, yes, please.
Please give me some word. Today, I believe it's May 26th, and it says, in a world of unrelentless changes, I am the one who never changes. This is Jesus talking. I am the Alpha and the Omega, the first and the last, the beginning and the end. Find me in the stability for which you have yearned. I created a beautifully ordered world, one that reflects my perfection. Now, however, the world is under bondage of sin and evil. Every person on the planet faces gasping jaws of uncertainty. The only antidote to this poisonous threat is drawing closer to me. In my presence, you can face any uncertainty. In my presence, you can find peace. That's the Jesus Calling for today. I'm Tre Tailor. Thank you again so much for joining me on Coping with COVID. Please continue to post and share this broadcast so we can get all of this important and needed information out to the masses. Please go to my professional page, Tre Tailor or Tailor Made Productions. Like and follow me there. Both of my personal pages are maxed out, but please like and follow me on Facebook, Instagram, and Twitter. Also, go to my YouTube channel where you can see all of the Coping with COVID interviews. Now, if you have a COVID-related message, service, or message, service, or product that would help folks during this coronavirus, please either inbox me on Facebook or email the Tailor Made Productions at gmail.com. THE Tailor with an I, Made Productions at gmail.com. And we'll talk about how you can be part of Coping with COVID. Tomorrow, we're going to talk with Cheryl Sally with SBDC and also Ashley Bell with Small Business Administration. We're going to talk about grants, loans, and services for minority and small businesses. Then on Thursday, we'll talk to J.R. Green with the Fairfield County School District. We're going to be talking about how school is going to look post-COVID. All of that and more coming up this week on Coping with COVID. I'm Tre Tailor. Thank you again so much, Dr. Macie. I appreciate
you so much
for watching, and stay safe, stay well, and God's blessings to you.